Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 50 practice NCLEX questions. Without the way, let's get started.
When caring for a terminally ill patient, a family member says, "I need your help to hasten my mother's so that she is no longer suffering." What should the nurse do, based on the position of the American Nurses Association in relation to assisted? 1. Not participate in active euthanasia. 2. Participate based on personal values and beliefs. 3. Participate when the patient is experiencing severe pain. 4. Not participate unless 2 primary healthcare providers are consulted and the patient has had counseling. The correct answer is 1. Not participate in active euthanasia. Nursing actions must comply with the law, and the law states that euthanasia is legally wrong. Euthanasia can lead to criminal charges of homicide or civil lawsuits for providing an unacceptable standard of care. A nurse's beliefs, values, or moral convictions should not be imposed on patients. Compassion and good intentions are not an acceptable basis for actions beyond the scope of nursing practice. Nurses, as well as other healthcare providers, cannot legally be involved with euthanasia. In some states in the United States, a primary healthcare provider can prescribe a medication that can be taken by a patient to cause death. The American Nurses Association, according to its Code for Nurses with Interpretive Statement, indicates that nurses should not participate in active euthanasia. Which organization is responsible for ensuring that nurses are minimally qualified to practice nursing? 1. State Boards of Nursing. 2. American Nurses Association. 3. Sigma Theta Tau International. 4. Constituent Leagues of the National League for Nursing. The correct answer is 1. State Boards of Nursing. The National Council of State Boards of Nursing is responsible for the NCLEX examinations. However, the licensing authority in the jurisdiction in which the graduate takes the examination verifies the acceptable score on the examination. For which primary reason is a nurse expert called to testify in a lawsuit regarding professional nursing malpractice? 1. To strengthen the defense. 2. To support the prosecution. 3. To present standards of nursing care as they apply to the facts in the case. 4. To make judgments associated with laws governing the practice of nursing. The correct answer is 3. To present standards of nursing care as they apply to the facts in the case. The American Nurses Association Standards of Clinical Nursing Practice are authoritative statements by which the National Organization for Nursing describes the responsibilities for which nurses are accountable. An expert nurse is capable of explaining these standards as they apply to the situation under litigation. These professional standards are criteria that help a judge or jury determine if a nurse committed malpractice or negligence. A nurse initiates a visit from a member of the clergy for a patient. How is the nurse functioning when initiating this visit? 1. Interdependently. 2. Independently. 3. Dependently. 4. Collegially. The correct answer is 2. Independently. A nurse does not need a primary healthcare provider's order to make a referral to a member of the clergy. An interdependent intervention requires a primary healthcare provider's order associated with a parameter. When a nurse initiates a referral to a member of the clergy, the nurse is working independently. A nurse can make a referral to a member of the clergy. This action is within the scope of nursing practice. The nurse can make a referral to a member of the clergy without collaborating with another professional healthcare team member. The HCP prescribed morphine 2 to 5 milligrams intramuscular every 2 hours for the client diagnosed with full thickness, burns to the chest and abdominal area. The client reports pain of 10 on a pain scale from 1 through 10. Which intervention should the nurse implement? 1. Administer 5 milligrams of morphine IM to the client immediately. 2. Contact the HCP to request an increase in the medication. 3. Request a patient-controlled analgesia pump for the client. 4. Assess the client for complications and then administer the medication. The correct answer is 3. Request a patient-controlled analgesia pump for the client. The client should have IV pain medication until hemodynamic stability and unimpaired tissue perfusion return. The PCA pump provides an IV route, and the client can control the amount of medication administered with the PCA, ensuring safe limits of pain medication. The client should receive IV medication, not IM medication. Therefore, the nurse should not administer this medication after assessing the client. The nurse should be a client advocate and notify the HCP for a change in the route of the morphine. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A client diagnosed with major depression has sleep and appetite disturbances and a flat affect and is withdrawn. The client has been taking fluvoxamine Luvox, 50 milligrams twice daily for 5 days. Which client behavior is most important to report to the next shift? 1. Client's flat affect. 2. Clients interacting with a visitor. 3. Client sleeping from 11 p.m. to 6 a.m. 4. Client spending the entire evening in her room. The correct answer is 3. Client sleeping from 11 p.m. to 6 a.m. Rationale. The most important behavior to report to the next shift is that the client was able to sleep from 11 p.m. to 6 a.m. This indicates that improvement in the symptoms of depression is occurring as a result of pharmacologic therapy. The nurse would expect to observe improvement in sleep, appetite, and psychomotor behavior first before improvement in cognitive symptoms. The client's flat affect is still a symptom of depression. The fact that the client had a visitor is not as important as changes in the client's behavior. Spending the evening in her room is a continuation of the client's withdrawn behavior and is important to report, but not as important as the improvement in sleep.
Phenylephrine, an adrenergic agonist, has been prescribed as a topical application for a patient who had intraocular surgery. Although systemic toxicity is unlikely, which adverse physiologic response is the concern? 1. Cardiovascular response, such as hypertension or ventricular dysrhythmias. 2. Renal response, such as urinary retention or urinary incontinence. 3. Respiratory response, such as bronchospasm or mucus plugs. 4. Musculoskeletal response, such as bone pain or joint stiffness. The correct answer is 1. Cardiovascular response, such as hypertension or ventricular dysrhythmias. Topical phenylephrine usually does not cause systemic reactions because the amount of absorption is very small. Cardiac responses are the concern. Other possible reactions may include sweating, tremors, agitation, or confusion. The nurse is assessing an older Caucasian male who has a history of peripheral vascular disease. The nurse observes that the man's left great toe is black. The discoloration is probably a result of 1. Atrophy, 2. Contraction, 3. Gangrene, 4. Rubor. The correct answer is 3. Gangrene. The term gangrene refers to blackened, decomposing tissue that is devoid of circulation. Chronic ischemia and death of the tissue can lead to gangrene in the affected extremity. Injury, edema, and decreased circulation lead to infection, gangrene, and tissue death. Atrophy is the shrinking of tissue, and contraction is joint stiffening secondary to disuse. The term rubor denotes a reddish color of the skin. The client with an abdominal hysterectomy is being prepared for discharge in the morning. The client has a mentally retarded adult son whom she cares for at home. The nurse should discuss with the physician the need for referral to which of the following departments? 1. Home health care. 2. Social work. 3. Pastoral care. 4. Volunteer services. The correct answer is 2. Social work. The social worker will be able to coordinate respite care for the son and other community resources for this family. Home health care would provide care for the client herself, but respite care for the son is the priority need for this family. Pastoral care provides spiritual care. The volunteer department would not be responsible for coordination of care at the client's home.
During an initial assessment of a client diagnosed with vasospastic disorder, Raynaud's phenomenon, the nurse notes a sudden color change from pink to white in the fingers. The nurse should first assess 1. appearance of cyanosis. 2. Radial pulse. 3. Oxygen saturation of the affected fingers. 4. Blood pressure. The correct answer is 2. Decreased perfusion from vasospasm induces color changes in the extremity. The degree of decreased perfusion should be assessed by taking the radial pulse. Color changes progressively to blue with cyanosis and then red when reperfusion occurs. The oxygen saturation requires adequate perfusion for accuracy. A blood pressure will cause further constriction and reduction of perfusion in the extremity. The emergency department nurse receives a call about a patient with a traumatic finger amputation. What instructions will the nurse provide to the patient's wife? Select all that apply. 1. Wrap the completely severed finger in dry sterile gauze or a clean cloth. 2. Put the finger in a watertight, sealed plastic bag. 3. Place the bag directly on ice. 4. Elevate the affected extremity above the patient's heart. 5. Examine the amputation site and apply direct pressure with layers of dry gauze. 6. After performing these steps, call 911 and check the patient for breathing. The correct answers are 1. Wrap the completely severed finger in dry sterile gauze or a clean cloth. 2. Put the finger in a watertight, sealed plastic bag. 4. Elevate the affected extremity above the patient's heart. And 5. Examine the amputation site and apply direct pressure with layers of dry gauze. Rationale. For a person who has a traumatic amputation in the community, first call 911 and then assess the patient for airway or breathing problems. Examine the amputation site and apply direct pressure with layers of dry gauze or cloth. Elevate the extremity above the patient's heart to decrease the bleeding. Do not remove the dressing to prevent dislodging the clot. Wrap the completely severed finger in dry sterile gauze or a clean cloth. Put the finger in a watertight, sealed plastic bag. Place the bag in ice water, never directly on ice, with 1 part ice and 3 parts water. Avoid contact between the finger and the water to prevent tissue damage. Do not remove any semi-detached parts of the digit. Be sure that the part goes with the patient to the hospital.
The nurse is preparing to administer a nitroglycerin transdermal patch to the client diagnosed with a myocardial infarction. Which intervention should the nurse implement? 1. Question applying the patch if the client's blood pressure is less than 110/70. 2. Use bare hands when applying the transdermal patch. 3. Date and time the transdermal patch prior to applying to client's skin. 4. Place the transdermal patch on the site where the old patch was removed. The correct answer is 3. Date and time the transdermal patch prior to applying to client's skin. The nurse should remove the old patch, wash the client's skin, note the date and time the new patch is applied, and apply it in a new area that is not hairy. The transdermal patch must be rotated so that skin irritation will not occur. Nitroglycerin, a coronary vasodilator, causes hypotension, and the nurse should question administering a transdermal patch if the client's blood pressure is less than 90/60, but not if it is less than 110/70. At a preconception visit, the nurse instructs the client on the importance of folic acid in the prevention of serious birth defects. Which statement to the nurse indicates the client needs more teaching? 1. I will increase my intake of spinach, orange juice, and almonds. 2. I will increase my intake of milk, yogurt, and fish. 3. I will take my prenatal vitamin with folic acid daily. 4. I will avoid overcooking my food to prevent vitamin loss. The correct answer is 2. I will increase my intake of milk, yogurt, and fish. Milk, yogurt, and fish are not a source of dietary folic acid. Green leafy vegetables, citrus foods, and nuts, such as peanuts and almonds, are rich in folic acid. A prenatal vitamin with 400 micrograms of folic acid is recommended for a client preparing for pregnancy or a client who is pregnant or lactating. Folic acid can prevent neural tube defects, cardiac defects, and cleft lip or palate. Folic acid can be lost when overcooking foods. The client has been diagnosed with chronic sinusitis. Which sign symptom alerts the nurse to a potentially life-threatening complication? 1. Muscle weakness. 2. Purulent sputum. 3. Nuchal rigidity. 4. Intermittent loss of muscle control, The correct answer is 3. Nuchal rigidity. Nuchal rigidity is a sign symptom of meningitis, which is a life-threatening potential complication of sinusitis resulting from the close proximity of the sinus cavities to the meninges. Intermittent loss of muscle control can be a symptom of multiple sclerosis, but it would not be a life-threatening complication of sinusitis. Muscle weakness is a sign symptom of myalgia, but it is not a life-threatening complication of sinusitis. Purulent sputum would be a sign symptom of a lung infection, but it is not a life-threatening complication of sinusitis. A basic knowledge of anatomy and physiology would help to answer this question. The sinuses lie in the head and surround the orbital cavity. Options 1 and 4 refer to muscle problems, so both could be ruled out as wrong.
The nurse is caring for a client who recently experienced a myocardial infarction and has been started on clopidogrel, Plavix. The nurse should develop a teaching plan that includes which of the following points? Select all that apply. 1. The client should report unexpected bleeding or bleeding that lasts a long time. 2. The client should take Plavix with food. 3. The client may bruise more easily and may experience bleeding gums. 4. Plavix works by preventing platelets from sticking together and forming a clot. 5. The client should drink a glass of water after taking Plavix. The correct answers are 1. The client should report unexpected bleeding or bleeding that lasts a long time. 3. The client may bruise more easily and may experience bleeding gums. And 4. Plavix works by preventing platelets from sticking together and forming a clot. Rationale. Plavix is generally well absorbed and may be taken with or without food. It should be taken at the same time every day, and while food may help prevent potential GI upset, food has no effect on absorption of the drug. Bleeding is the most common adverse effect of Plavix. The client must understand the importance of reporting any unexpected, prolonged, or excessive bleeding, including blood in urine or stool. Increased bruising and bleeding gums are possible side effects of Plavix. The client should be aware of this possibility. Plavix is an antiplatelet agent used to prevent clot formation in clients that have experienced or are at risk for myocardial infarction, ischemic stroke, peripheral artery disease, or acute coronary syndrome. It is not necessary to drink a glass of water after taking Plavix.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is providing orientation for a new nurse who is preparing to administer packed red blood cells to a patient who had blood loss during surgery. Which action by the new nurse requires that the nurse intervene immediately? 1. Waiting 20 minutes after obtaining the PRBCs before starting the infusion. 2. Starting an IV line for the transfusion using a 22-gauge catheter. 3. Priming the transfusion set using 5% dextrose in lactated Ringer's solution. 4. Telling the patient that the PRBCs may cause a serious transfusion reaction. The correct answer is 3. Priming the transfusion set using 5% dextrose in lactated Ringer's solution. Normal saline, an isotonic solution, should be used when priming the IV line to avoid causing hemolysis of red blood cells. Ideally, blood products should be infused as soon as possible after they are obtained. However, a 20-minute delay would not be unsafe. Large-bore IV catheters are preferable for blood administration. If a smaller catheter must be used, normal saline may be used to dilute the RBCs. Although the new nurse should avoid increasing patient anxiety by indicating that a serious transfusion reaction may occur, this action is not as high a concern as using an inappropriate fluid for priming the IV tubing. A client has entered a smoking cessation program to quit a 2-pack-a-day cigarette habit. The client has not smoked a cigarette for 3 weeks and tells the nurse about fears of starting smoking again because of current job pressures. What would be the most appropriate reply for the nurse to make in response to the client's comments? 1. Don't worry about it. Everybody has difficulty quitting smoking, and you should expect to as well. 2. If you increase your self-control, I am sure you will be able to avoid smoking. 3. Try taking a couple of days of vacation to relieve the stress of your job. 4. It is good that you can talk about your concerns. Try calling a friend when you want to smoke. The correct answer is 4. It is good that you can talk about your concerns. Try calling a friend when you want to smoke. It is important for individuals who are engaged in smoking cessation efforts to feel comfortable with sharing their fears of failure with others and seeking support. Although fewer than 5% of smokers successfully quit on their first attempt, it is not helpful to tell a client to anticipate failure. Telling the client to exercise more self-control does not provide support. Taking a vacation to avoid job pressures does not address the issue of how to manage the desire to smoke when in a stressful situation. The nurse assesses the client's stoma during the initial post-operative period. Which of the following observations should be reported immediately to the physician? 1. The stoma is slightly edematous. 2. The stoma is dark red to purple. 3. The stoma oozes a small amount of blood. 4. The stoma does not expel stool. The correct answer is 2. The stoma is dark red to purple. A dark red to purple stoma indicates inadequate blood supply. Mild edema and slight oozing of blood are normal in the early post-operative period. The colostomy would typically not begin functioning until 2 to 4 days after surgery.
The nurse is administering packed red blood cells to a client. The nurse should first 1. Discontinue the IV catheter if a blood transfusion reaction occurs. 2. Administer the PRBCs through a percutaneously inserted central catheter line with a 20-gauge needle. 3. Flush PRBCs with 5% dextrose and 0.45% normal saline solution. 4. Stay with the client during the first 15 minutes of infusion. The correct answer is 4. The most likely time for a blood transfusion reaction to occur is during the first 15 minutes or first 50 milliliters of the infusion. If a blood transfusion reaction does occur, it is imperative to keep an established IV line so that medication can be administered to prevent or treat cardiovascular collapse in case of anaphylaxis. PRBC should be administered through a 19-gauge or larger needle. A peripherally inserted central catheter line is not recommended. In order to avoid a slow flow, RBCs will hemolyze in dextrose or lactated ringer solution and should be infused with only normal saline solution. A patient who underwent a right above the knee amputation 4 days ago also has a diagnosis of depression. Which prescription would the nurse clarify with the healthcare provider? 1. Give fluoxetine 40 milligrams once a day. 2. Administer acetaminophen with codeine 1 or 2 tablets every 4 hours as needed. 3. Assist a patient to the bedside chair every shift. 4. Reinforce the dressing to the right residual limb as needed. The correct answer is 1. Give fluoxetine 40 milligrams once a day. Rationale. Doses of fluoxetine, a drug used to treat depression, that are greater than 20 milligrams should be given in 2 divided doses, not once a day. The other 3 prescriptions are appropriate for a patient who underwent amputation 4 days earlier.
The client diagnosed with coronary artery disease is instructed to take 81 milligrams of aspirin. Which statement best describes the scientific rationale for prescribing this medication? 1. This medication will help thin the client's blood. 2. Daily aspirin will decrease the incidence of angina. 3. This medication will prevent platelet aggregation. 4. Baby aspirin will not cause gastric distress. The correct answer is 3. This medication will prevent platelet aggregation. When 81 milligrams of aspirin, a baby aspirin, is taken daily, it helps prevent platelet aggregation, which, in turn, helps the blood pass through the narrowed arteries more easily. The nurse is preparing to administer topical benzocaine to a client with a 4th-degree episiotomy. Which interventions should the nurse implement? Rank in order of performance. 1. Position the client on the side with top leg up and forward. 2. Wash hands and don non-sterile examination gloves. 3. Check the client's MAR with the identification band. 4. Ask the client if she is allergic to any cane drugs. 5. Apply the benzocaine to the perineal area. The correct order is 3. Check the client's MAR with the identification band. 4. Ask the client if she is allergic to any cane drugs. 2. Wash hands and don non-sterile examination gloves. 1. Position the client on the side with top leg up and forward. And 5. Apply the benzocaine to the perineal area. The nurse must first determine if this is the right client receiving the right medication. The nurse should always check for allergies. With this medication, cane drugs are anesthetics, and if the client is allergic to lidocaine or novocaine, the client should not receive this medication. Once the nurse determines that this is the right client to receive the right medication and that the client has no allergies, then the nurse must wash his or her hands and use gloves to administer a medication to the perineal area. The position on the side with top leg up and forward allows maximum exposure to the area that should be medicated. After completing all the previous steps, the nurse can apply the medication. The nurse is planning the care of a client diagnosed with pneumonia and writes a problem of impaired gas exchange. Which is an expected outcome for this problem? 1. Performs chest physiotherapy 3 times a day. 2. Able to complete activities of daily living. 3. Ambulates in the hall several times during each shift. 4. Alert and oriented to person, place, time, and events. The correct answer is 4. Alert and oriented to person, place, time, and events. Impaired gas exchange results in hypoxia, the earliest sign-symptom of which is a change in the level of consciousness. Clients do not perform chest physiotherapy. This is normally done by the respiratory therapist. Option 1 is a staff goal, not a client goal. Option 2 would be a goal for self-care deficit, but not for impaired gas exchange. Option 3 would be a goal for the problem of activity intolerance. You should match the answer option to the listed nursing problem. When writing goals for the client, it is important to remember they are written in terms of what is expected of the client.
Crackles heard on lung auscultation indicate which of the following? 1. Cyanosis. 2. Bronchospasm. 3. Airway narrowing. 4. Fluid-filled alveoli. The correct answer is 4. Fluid-filled alveoli. Rationale. Crackles are auscultated over fluid-filled alveoli. Crackles heard on lung auscultation do not have to be associated with cyanosis. Bronchospasm and airway narrowing generally are associated with wheezing sounds.
When the nurse is assessing a patient with chronic kidney disease who is receiving epoetin alpha injections, which finding most indicates a need to talk with the healthcare provider before giving the medication. 1. Hemoglobin level is 8.9 grams per deciliter. 2. Blood pressure is 198/92. 3. The patient does not like subcutaneous injections. 4. The patient has a history of myocardial infarction. The correct answer is 2. Blood pressure is 198/92. Epoetin alpha can cause hypertension, and blood pressure should be controlled before administering the medication. Because patients with chronic kidney disease have chronic anemia, a hemoglobin level of 8.9 grams per deciliter is not unusual. Although the nurse could ask the HCP about IV administration of the medication, subcutaneous administration requires a lower dose of the medication and is preferred. Epoetin alpha can cause angina or myocardial infarction, but the risk is highest when hemoglobin levels are greater than 11 grams per deciliter. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client is admitted to the emergency department diagnosed with a partial and full thickness burn to the left leg. Which question is most important for the nurse to ask the client? 1. When was your last tetanus shot? 2. Can you tell me how this burn happened? 3. Will you need any help when you go home? 4. Have you taken any antibiotics in the last week? The correct answer is 1. When was your last tetanus shot? A tetanus toxoid is administered intramuscularly early in the acute phase of burn care to prevent Clostridium tetani infection. If the client has not had a tetanus shot within the last 10 years, or if the time is in doubt, a booster of tetanus toxoid should be administered. The client diagnosed with a partial thickness, burn to the entire right leg, who is being treated with silver sulfadiazine, develops leukopenia. Which medication should the nurse expect the HCP to prescribe? 1. Discontinue the silver sulfadiazine ointment immediately. 2. Continue administering the silver sulfadiazine ointment. 3. Administer aminoglycoside antibiotics intravenously. 4. Administer hydrocortisone cream to the burned area. The correct answer is 2. Continue administering the silver sulfadiazine ointment. Silver sulfadiazine is a sulfonamide antibacterial agent. Many clients develop marked leukopenia in response to silver sulfadiazine. The leukopenia will improve spontaneously over the course of treatment. Leukopenia does not contraindicate use of this medication. Leukopenia improves over the course of the treatment with silver sulfadiazine and does not warrant discontinuing the medication. Leukopenia, secondary to silver sulfadiazine therapy, does not warrant the administration of aminoglycoside antibiotics. Hydrocortisone cream does not treat leukopenia secondary to silver sulfadiazine. Which client should the nurse use caution with when applying mafenide acetate to a burned area? 1. A client with a creatinine level of 0.8 mg per deciliter. 2. A client diagnosed with chronic obstructive pulmonary disease. 3. A client with a pulse oximeter reading of 95%. 4. A client diagnosed with type 2 diabetes who is taking insulin. The correct answer is 2. A client diagnosed with chronic obstructive pulmonary disease. Mafenide acetate is a topical antimicrobial. Mafenide acetate impairs the renal mechanism involved in the buffering of the blood, thereby increasing the excretion of bicarbonate in the urine. When this occurs, the pulmonary system effects a compensatory hyperventilatory status to maintain normal acid-base balance. If this compensation cannot take place as a result of pulmonary disease, the client develops metabolic acidosis. Mafenide acetate affects the acid-base balance in the body and should not be administered to clients diagnosed with renal disease. A 0.8 mg per deciliter serum creatinine level is within normal range of 0.5 to 1.5 mg per deciliter. Therefore, the nurse would not need to use caution with this client. This client has adequate respiratory status. Therefore, the nurse would not need to use caution with this client. There is no reason a client diagnosed with diabetes could not be prescribed mafenide acetate. The client diagnosed with partial and full thickness, burns to 35% of the body, is admitted to the burn department. The HCP has prescribed famotidine. Which statement best describes the scientific rationale for administering this medication? 1. Famotidine acts on the cell wall to prevent bacterial growth. 2. Famotidine will help control the client's pain. 3. Famotidine will help decrease the client's nausea and vomiting. 4. Famotidine will help decrease gastric acid production. The correct answer is 4. Famotidine will help decrease gastric acid production. Curling's ulcer is an acute ulceration of the stomach or duodenum that forms following a burn injury. Histamine 2 antagonists like famotidine are administered to decrease gastric acid secretion in the acute phase of burn care. Silver sulfadiazine, a topical antimicrobial, not famotidine, acts on the cell membrane and cell wall of susceptible bacteria and binds to cellular DNA. IV opioid medications, not famotidine, will help decrease the client's pain. Antiemetics, not famotidine, will help prevent the client's nausea and vomiting.
The client with depression has been consistent with taking 12.5 milligrams of paroxetine, Paxil, extended release daily. The nurse judges the client to be benefiting from this drug therapy when the client demonstrates which of the following behaviors? Select all that apply. 1. Takes 2-hour evening naps daily. 2. Completes homework assignments. 3. Decreases pacing. 4. Increases somatization. 5. Verbalizes feelings. The correct answers are 2. completes homework assignments. 3, decreases pacing. And 5, verbalizes feelings. Rationale. Symptoms of depression include depressed mood, appetite disturbance, sleep disturbance, psychomotor disturbance, fatigue, feelings of worthlessness, excessive or inappropriate guilt, and decreased concentration. Paroxetine is a selective serotonin reuptake inhibitor antidepressant that also can be used to treat anxiety. Improved concentration, verbalization of feelings, and decreased agitation or pacing are signs of improvement. Taking 2-hour evening naps daily is still a sign of fatigue or lack of energy, and the increased use of somatization could be signs of continued symptoms of depression.
The nurse is supervising a new nurse who has just finished assessing a patient for redness and discomfort to the right eye. The new nurse documents visual acuity NA. Which action would the supervising nurse take? 1. Do nothing. The documentation is minimal but acceptable. 2. Ask her to explain the rationale for the documentation. 3. Reassess the patient's eye and vision to validate findings. 4. Suggest contacting the clinical educator for documentation tips. The correct answer is 2. Ask her to explain the rationale for the documentation. Asking the nurse to explain the documentation is a way of assessing her knowledge of documentation, her understanding of how the patient's report guides the focused assessment, and her understanding of the use of abbreviations. The nurse may have a good reason for charting NA, but a reader could misunderstand. For example, visual acuity NA could be interpreted as the nurse making a clinical judgment that assessing vision was not applicable for this patient. The documentation is not acceptable because the patient's report indicates that vision should be tested if at all possible. Redoing the assessment does not help the nurse to correct mistakes. Contacting the educator for assistance is an option that is based on assessment of her rationale. A client with heart failure has bilateral +4 edema of the right ankle that extends up to the midcalf. The client is sitting in a chair with the legs in a dependent position. Which of the following goals is the priority? 1. Decrease venous congestion. 2. Maintain normal respirations. 3. Maintain body temperature. 4. Prevent injury to lower extremities. The correct answer is 1. Decrease venous congestion. Decreasing venous congestion in the extremities is a desired outcome for clients with heart failure. The nurse should elevate the client's legs above the level of the heart to achieve this goal. The client is not demonstrating difficulty breathing or being cold. The nurse should prevent injury to the swollen extremity. However, this is not the priority. The nurse is changing the dressing of a client after an abdominal hysterectomy. Which of the following nursing measures would be most appropriate if the dressing adheres to the client's incisional area? 1. Pull off the dressing quickly and then apply slight pressure over the area. 2. Lift an easily moved portion of the dressing and then remove it slowly. 3. Moisten the dressing with sterile normal saline solution and then remove it. 4. Remove part of the dressing and then remove the remainder gradually over a period of several minutes. The correct answer is 3. Moisten the dressing with sterile normal saline solution and then remove it. When a dressing sticks to a wound, it is best to moisten the dressing with sterile normal saline solution and then remove it carefully. Trying to remove a dry dressing is likely to irritate the skin and wound. This may contribute to tension or tearing along the suture line.
The client with vasospastic disorder, Raynaud's phenomenon, has coldness and numbness in the fingers. The nurse assesses the client for effects of vasoconstriction. Which of the following is an early sign of vasoconstriction? 1. Cyanosis. 2. Gangrene. 3. Pallor. 4. Rubor. The correct answer is 3. Initially, the vasoconstriction effect produces pallor or a whitish coloring, followed by cyanosis and finally rubor. Gangrene is the end result of complete arterial occlusion. The skin is blackened and without a blood supply. The nurse is providing care for a patient with a rotator cuff tear. What treatment does the nurse expect a healthcare provider will prescribe first for this patient? 1. Arthroscopic repair of the rotator cuff tear. 2. elimination of movements in the affected shoulder. 3. Conservative therapies, such as nonsteroidal anti-inflammatory drugs and physical therapy. 4. Pendulum exercises that start slow and progress over 2 weeks. The correct answer is 3. Conservative therapies, such as nonsteroidal anti-inflammatory drugs and physical therapy. Rationale. For the patient with a torn rotator cuff, the HCP usually treats the patient conservatively with NSAIDs, intermittent steroid injections, physical therapy, and activity limitations while the tear heals. Physical therapy treatments may include ultrasound, electrical stimulation, ice, and heat.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is teaching the client diagnosed with angina about sublingual nitroglycerin. Which statement indicates the client needs more medication teaching? 1. I will always carry my nitroglycerin in a dark-colored bottle. 2. If I have chest pain, I will put a tablet underneath my tongue. 3. If my pain is not relieved with one tablet, I will get medical help. 4. I should expect to get a headache after taking my nitroglycerin. The correct answer is 3. If my pain is not relieved with one tablet, I will get medical help. The client should put one tablet under the tongue every 5 minutes, and if the chest pain is not relieved after taking 3 tablets, the client should seek medical attention. This statement indicates the client needs more teaching about the medication. The client who is pregnant is prescribed ferrous sulfate. Which statement indicates to the nurse the client needs more teaching? 1. I should increase my fluid intake and fiber when taking this medication. 2. I will take a daily stool softener to prevent becoming constipated. 3. If I notice that my stool becomes black or dark, I will call my obstetrician. 4. I should take my iron tablet 2 hours after I eat. The correct answer is 3. If I notice that my stool becomes black or dark, I will call my obstetrician. Ferrous sulfate, an iron product, causes the stool to become black and tarry. Therefore, the client would not need to notify the obstetrician. The client should increase fluid and fiber to help decrease the possibility of becoming constipated. The client is instructed to take a daily stool softener to prevent constipation. Iron should be taken between meals, 2 hours after a meal, because food decreases absorption of the medication by 50% to 70%. Which information should the nurse teach the client diagnosed with acute sinusitis? 1. Instruct the client to complete all the ordered antibiotics. 2. Teach the client how to irrigate the nasal passages. 3. Have the client demonstrate how to blow the nose. 4. Give the client samples of a narcotic analgesic for the headache. The correct answer is 1. Instruct the client to complete all the ordered antibiotics. The client should be taught to take all antibiotics as ordered. Discontinuing antibiotics prior to the full dose results in the development of antibiotic-resistant bacteria. Sinus infections are difficult to treat and may become chronic and will then require several weeks of therapy or possibly surgery to control. If the sinuses are irrigated, it is done under anesthesia by a healthcare provider. Blowing the nose will increase pressure in the sinus cavities and will cause the client increased pain. The nurse is not licensed to prescribe medications, so this is not in the nurse's scope of practice. Also, narcotic analgesic medications are controlled substances and require written documentation of being prescribed by the healthcare provider. Samples are not generally available. Note in this situation, an all is in the correct answer. There are very few cases in which absolute adjectives will describe the correct answer. You must be aware that general rules will not always apply.
Which of the following is the most appropriate diet for a client during the acute phase of myocardial infarction? 1. Liquids as desired. 2. Small, easily digested meals. 3. 3 regular meals per day. 4. Nothing by mouth. The correct answer is 2. Small, easily digested meals. Rationale. Recommended dietary principles in the acute phase of MI include avoiding large meals because small, easily digested foods are better tolerated. Fluids are given according to the client's needs, and sodium restrictions may be prescribed, especially for clients with manifestations of heart failure. Cholesterol restrictions may be prescribed as well. Clients are not prescribed diets of liquids only or restricted to nothing by mouth unless their condition is very unstable.
The nurse is reviewing the complete blood count for a patient who has been admitted for knee arthroscopy. Which value is most important to report to the healthcare provider before surgery? 1. Hematocrit of 33%. 2. Hemoglobin level of 10.9 grams per deciliter. 3. Platelet count of 426,000 cubic milliliters. 4. White blood cell count of 16,000 cubic milliliters. The correct answer is 4. White blood cell count of 16,000 cubic milliliters. Centers for Disease Control and Prevention guidelines for the prevention of surgical site infections indicate that surgery should be postponed when there is evidence of a pre-existing infection, such as an elevation in white blood cell count. The other values are slightly abnormal, but would not be likely to cause post-operative problems for knee arthroscopy. The nurse is preparing a community presentation on oral cancer. Which of the following is a primary risk factor for oral cancer that the nurse should include in the presentation? 1. Use of alcohol. 2. Frequent use of mouthwash. 3. Lack of vitamin B12. 4. Lack of regular teeth cleaning by a dentist. The correct answer is 1. Use of alcohol. Chronic and excessive use of alcohol can lead to oral cancer. Smoking and use of smokeless tobacco are other significant risk factors. Additional risk factors include chronic irritation, such as a broken tooth or ill-fitting dentures, poor dental hygiene, overexposure to sun, lip cancer, and syphilis. Use of mouthwash, lack of vitamin B12, and lack of regular teeth cleaning appointments have not been implicated as primary risk factors for oral cancer. The client with colon cancer has an abdominal perineal resection with a colostomy. Which of the following nursing interventions is most appropriate for this client in the post-operative period? 1. Maintain the client in a semi-Fowler's position. 2. Assist the client with warm sitz baths. 3. Administer 30 milliliters of milk of magnesia to stimulate peristalsis. 4. Remove the ostomy pouch as needed so the stoma can be assessed. The correct answer is 2. Assist the client with warm sitz baths. Appropriate nursing interventions after an abdominal perineal resection with a colostomy include assisting the client with warm sitz baths 3 to 4 times a day to clean the perineal incision. The client will be more comfortable assuming a side-lying position because of the perineal incision. It would be inappropriate to administer milk of magnesia to stimulate colostomy activity. Stool passage will begin as peristalsis returns. It is not necessary or desirable to change the ostomy pouch daily to assess the stoma. The ostomy pouch should be transparent to allow easy observation of the stoma and drainage.
In a postoperative client, the hematocrit decreased from 36% to 34% on the third day, even though the red blood cell count and hemoglobin value remained stable at 4.5 millions per microliter and 11.9 grams per deciliter, respectively. The nurse should next 1. Check the dressing and drains for frank bleeding. 2. Call the physician. 3. Continue to monitor vital signs. 4. Start oxygen at 2 liters per minute per nasal cannula. The correct answer is 3. The nurse should continue to monitor the client because this value reflects a normal physiologic response. The physician does not need to be called, and oxygen does not need to be started based on these laboratory findings. Immediately after surgery, the client's hematocrit reflects a falsely high value related to the body's compensatory response to the stress of sudden loss of fluids and blood. Activation of the intrinsic pathway and the renin-angiotensin cycle via antidiuretic hormone produces vasoconstriction and retention of fluid for first 1 to 2 days post-operatively. By the 2nd to 3rd day, this response decreases, and the client's hematocrit level is more reflective of the amount of RBCs in the plasma. Fresh bleeding is a less likely occurrence on the third postoperative day, but is not impossible. However, the nurse should have expected to see a decrease in the RBC count and hemoglobin value accompanying the hematocrit. During the assessment of a patient with fractures of the medial ulna and radius, the nurse finds all of these data. Which assessment findings should the nurse report to the healthcare provider immediately? 1. The patient reports pressure and pain. 2. The cast is in place and is dry and intact. 3. The skin is pink and warm to the touch. 4. The patient can move all the fingers and the thumb. The correct answer is 1. The patient reports pressure and pain. Rationale. Pressure and pain may be caused by increased compartment pressure and can indicate the serious complication of acute compartment syndrome. This situation is urgent. If it is not treated, cyanosis, tingling, numbness, paresis, and severe pain can occur. The other findings are normal and should be documented in the patient's chart.
The client diagnosed with coronary artery disease is prescribed atorvastatin. Which statement by the client warrants the nurse notifying the HCP? 1. I really haven't changed my diet, but I am taking my medication every day. 2. I am feeling pretty good, except I am having muscle pain all over my body. 3. I am swimming at the local pool about 3 times a week for 30 minutes. 4. I am taking this medication first thing in the morning with a bowl of oatmeal. The correct answer is 2. I am feeling pretty good, except I am having muscle pain all over my body. Atorvastatin is an HMG-CoA reductase inhibitor, or a statin. Statins can cause muscle injury, which can lead to myositis, fatal rhabdomyolysis, or myopathy. Muscle pain or tenderness should be reported to the HCP immediately. Usually the medication is discontinued. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is assisting the certified registered nurse anesthetist in placing an epidural in a laboring client. Which findings would indicate intravascular injection of the local anesthetic? Select all that apply. 1. Tachycardia. 2. Pruritus. 3. Tinnitus. 4. Sedation. 5. Dizziness. The correct answers are 1. Tachycardia, 3. Tinnitus, and 5. Dizziness. Tachycardia is a symptom of intravascular injection of a local anesthetic. Tinnitus is a symptom of intravascular injection of a local anesthetic. Dizziness is a symptom of intravascular injection of a local anesthetic. Pruritus, itching, is a symptom of an allergic reaction. Intravascular injection does not cause sedation in the client. The nurse is assessing a 79-year-old client diagnosed with pneumonia. Which signs and symptoms should the nurse expect to assess in the client? 1. Confusion and lethargy. 2. High fever and chills. 3. Frothy sputum and edema. 4. Bradypnea and jugular vein distension. The correct answer is 1. Confusion and lethargy. The elderly client diagnosed with pneumonia may present with weakness, fatigue, lethargy, confusion, and poor appetite, but not have any of the classic signs and symptoms of pneumonia. Fever and chills are classic symptoms of pneumonia, but they are usually absent in the elderly client. Frothy sputum and edema are signs and symptoms of heart failure, not pneumonia. The client has tachypnea, not bradypnea, and jugular vein distension accompanies heart failure.
A client has driven himself to the emergency department. He is 50 years old, has a history of hypertension, and informs the nurse that his father died from a heart attack at age 60. The client has indigestion. The nurse connects him to an electrocardiogram monitor and begins administering oxygen at 2 liters per minute per nasal cannula. The nurse's next action should be to 1. Call for the physician. 2. Start an IV infusion. 3. Obtain a portable chest radiograph. 4. Draw blood for laboratory studies. The correct answer is 2. Start an IV infusion. Rationale. Advanced Cardiac Life Support recommends that at least 1 or 2 IV lines be inserted in one or both of the anticubal spaces. Calling the physician, obtaining a portable chest radiograph, and drawing blood for the laboratory are important but secondary to starting the IV line.
A patient with iron deficiency anemia who is taking oral iron supplements is evaluated by the nurse in the outpatient clinic. Which finding by the nurse is of most concern? 1. The patient reports that stools are black. 2. The patient complains of occasional constipation. 3. The patient takes a multivitamin tablet every day. 4. The patient takes an antacid with the iron to avoid nausea. The correct answer is 4. The patient takes an antacid with the iron to avoid nausea. Concurrent use of antacids with iron supplements will decrease absorption of the iron and decrease the efficacy in resolving the patient's anemia. Black stools are expected when taking oral iron. The patient's occasional constipation may indicate a need for information about prevention of constipation while taking iron. Use of a multivitamin tablet is safe when taking iron supplements. The nurse is caring for a client who has had a gastroscopy. Which of the following may indicate that the client is developing a complication related to the procedure? Select all that apply. 1. The client has a sore throat. 2. The client has a temperature of 100 degrees Fahrenheit. 3. The client appears drowsy following the procedure. 4. The client has epigastric pain. 5. The client experiences hematemesis. The correct answers are 2. The client has a temperature of 100 degrees Fahrenheit. 4. The client has epigastric pain. And 5. The client experiences hematemesis. Following a gastroscopy, the nurse should monitor the client for complications, which include perforation and the potential for aspiration. An elevated temperature, epigastric pain, or the vomiting of blood are all indications of a possible perforation and should be reported promptly. A sore throat is a common occurrence following a gastroscopy. Clients are usually sedated to decrease anxiety, and the nurse would anticipate that the client will be drowsy following the procedure. You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.